So I started suffering with heavy periods when I was 11-year-old, so basically from day one. They were very heavy, very painful, and very prolonged. I used to average between 9 and 12 days, heavy bleeding at that point. And obviously school age, so you had school, secondary school, so your hormones were kicking in, so very embarrassing. Used to seriously restrict me from physical activities, and that's never really stopped. I suppose over years, they've peaked and troughs. So at 12-year-old, I was placed on contraception to control the periods, which was fine, and it was great, and it reduced them drastically. However, they were still heavy and painful. I started getting severely ill with them as I was about 17, 18, when I was bleeding for approximately 3 months at a time, severely, heavy clotting, becoming anemic, very draining, to a point I was collapsing at work because I started working when I was 16, and struggling with my home life as well. Obviously, I was a carer as well for my mum, so that it made that responsibility much harder. So at 19, I collapsed to a degree where I was really ill, and I was admitted, and the hospital, the gynecology department, didn't know what to do with me. So they basically, after a day of investigating and interrogating, they provided me with a bag full of tablets and just basically said something will work. But then we managed to find some alternative methods. So I tried the coil, I tried the implant, I tried the injection, and they all reacted differently to me with the hormones that they hosted. So eventually we did find a triphasic pill, it was called, so it increased the hormones week by week, which seemed to settle everything for quite some time, and it was lovely. It was as lovely as menstrual bleeding can be. At that point I was 31. Sterilisation, great, no more contraceptives, but unfortunately heavy periods all over again, and they slowly got worse and worse and worse. I do describe it as ill. I think it's massively under acknowledged what women have to go through when it comes to menstrual bleeding. It affects so much your mind, your body, everything. Obviously, they tried to put me back on some form of contraceptive methods, and I agreed in the end to retry the Mirena coil, which literally took me back to being 19-year-old again, when I was bleeding for 3 and 4 months at a time, which again, it's just draining. It was not a viable option to continue with, so I had to fight for the coil removing again. And I sort of at that point just settled for the fact that this is how I was going to be until I went through the change. Because everything was so chaotic and I was having hot flushes and everything else, I went to see the nurse in my GP who deals with everything to do with contraception and menstrual cycles, and I suggested to her that I was potentially preparing to go through the change, to which she says basically, well, there's naught we can do. What do you think we're going to do about it? We can't help you. There's naught we can do. You just got to get on with it, pull your socks up and carry on, which left me very deflated, if I'm perfectly honest. It's just I felt like I'd exhausted every option at that point. I sat with it, and I just left with it. So for the last 4.5 years, I just carried on best I could. I suppose in a strange sort of way, I was quite lucky the pandemic came along, because I work from home, so whenever I had my cycle, I didn't have to worry about trying to find an office that were next door to toilet, or take 2 and 3 packets full of pads with me every day to work. I just could sit at home and hopefully be comfortable enough to deal with it when I was ill. I went back to my GPs and I refused to see the usual GPs that I had, and I luckily managed to get hold of a wonderful GP. She was a lovely lady, and she kindly referred me up into the gynecology department at Barnsley Hospital, and that was the first time I heard about ablation. It sounded scary, I won't lie, but at the same time it was like a breath of fresh air. So when I went to my GPs, they the nurse, the GP, the doctor, they referred me into gynecology, and I met a wonderful nurse, lovely gynecological assistant called Alison, and she was so comforting and friendly, and I can't explain it. It was so nice. So obviously I went to see Alison, and she took me in to see the consultant, and I actually went in with the mind that I was having a hysterectomy. I just wanted it taken away. I wanted everything gone. I didn't want any more issues. The first discussion was very much, she says, well, it's not fashionable to have an hysterectomy, to which point I was really, what do you mean it's not fashionable? He says in his career, if he gave 4 hysterectomies a year, it was an extreme. But because he doesn't do it anymore, it's because of ablation. So I took the pain relief on the day, rocked up, nervous as ever, because you know it's different, and I've had many different operations in the past, but this was just something totally different. The staff were fantastic. They took you in, they calmed you down, cup of tea, just relax. Went into the room, and there were 3 fabulous nurses sat waiting for me, and so funny. They did nothing but make me laugh, and they had to, because if they didn't make me laugh, I think I'd have probably cried because I was scared. So then we started, and me and the nurse were talking about the most utter rubbish you could possibly think of, just to pass the 90 seconds that it was, literally 90 seconds of the procedure starting. Alison afterwards, because I was actually watching the procedure, which I thought were fantastic. So I'm a bit nosy. I like to watch things, so I'm actually watching what was happening on the screen. And the total geek inside of me thought it was just wondrous. Modern medicine is absolutely fantastic. But it worked. It worked. Afterwards, Alison said to me, "What were your pain like during the procedure?" And I said, from 1 to 10, and I said, about 7-ish. 7. What's your pain now? I'd only moved from bed to chair. I went, nothing. It's gone. Everything had gone. No pain, no cramping, no nothing. So it was so surreal to know that you're going from all this history, this pain, this rubbish at month on month, to go in with that little bit of discomfort to something that's going to totally change your world as a woman. If I hadn't dropped on that particular nurse in that particular gynecology department, I don't think I'd have ever heard of it, because I haven't. For me, it was one of the most fantastic experiences, be it a little bit uncomfortable in between. It worked. It was a breeze in the long scheme. So yeah, really fantastic. Taking in mind that I have blood thinners, so my recovery is different to other women that are not on blood thinners, so we've got to remember that. So I had discharge for 6 weeks, and within that 6 weeks I had a period, if you could call it a period. It was laughable compared. It was a couple of days of just extra bleeding. I don't have a regular cycle, a very regular cycle, but I've gone from bleeding between 9 and 13 days to 3. If I'm lucky, I can wear Tampax again, and the amount of blood would probably equate to a tablespoon over those 3 days. That's how fantastic it's been for me. It's a breeze now to do what I need. I have no pain, I have no backache, I don't feel sick, I don't get lethargic, nothing. It's how it should be. I felt rejected from the doctors and dispelled and a little bit lost. I actually started tracking my periods. I had a diary, just use my phone diary if I'm perfectly honest, just what would happen in what day, how I felt, mood, pain, heaviness of the period. But I also researched as much as I possibly could on the internet, looked at the options available at my age. Very much so, childbearing age is a massive impact irrespective of what you're going through as an individual. It's that's one of the professionals' key things to investigate and go against. If you are going to go speak to a gynecologist, please, or your GP or your nurse at your GPs, go forearmed so you don't walk away like I did. Take that information, decide what you want as a woman for your treatment. It's your choice. Remember that it is your choice. Yeah, they're the professionals and they can advise, but you can tell them what you want and what you need. So take the information, look online, look at any relevant material you can find and present them with the evidence, because they can't push it away then. They've got what you need and you're telling them what you need. It's your choice, it's your body, it's your time to push for that change. So please make sure that you're ready for that as well.